What are some useless tests you said these IVF doctors?
Okay. So you break it up into men and women. Both are fertile for exploiting. So men ke liye, the only useful test for us, whenever a man does a test, what's the question he's asking? Can I get my wife pregnant with my sperm? That's the only thing he wants. You can't answer that question. Let me tell you right now. All you can do is a semen analysis, which means you can do the sperm count. But a sperm count is not like a bank account. Ultimately, fertility depends on the fertility of the husband and the wife. Now, there are people whose sperm count is only 2 million, which is very low. Normal is 15 million, whose wife is very fertile, who have 2 babies in the bedroom. But they have enough sense not to go to a doctor and get their sperm test done. So who are the guys who go to a doctor? Only someone who thinks they have a problem. So doctor ka bhi bias hone lagta hai, and some doctors think they're the smartest. And it's all no longer evidence-based medicine. It is eminence-based medicine. In my 30 years of experience, whatever. So this didn't work. So now you'll do a lot of more tests because semen analysis is not good enough. So we'll do sperm DNA fragmentation. We'll do a chromosome study. We'll do a microdeletion. We'll do a teaser. All this stuff is on my website, incidentally, if you want to go into the gory details of all the useless tests.
But all of these are not needed, you're saying?
At all.
Oh.
See, which is I always tell patients, you only need to ask a doctor one question when he tells you to do a test. This is true whether you're a cardiologist or a neurologist or an IVF. How will this test change my treatment options? If it is not going to change my treatment options, please don't use me as a guinea pig and don't make me waste my money because all these are very expensive tests. And then what happens? You do a test. It's abnormal. Dekh, ye problem hai. Abhi tu ye goli kha. Fir se test kar. Dekh, ye problem hai. Not related. Abhi ye problem aaya. Abhi tujhko IVF karna padega. Just creating work for themselves. Let me tell you that. So anyway, there's a long list. That's just giving you one example. These are called advanced sperm function tests. And sperm DNA fragmentation is a great example of it. Doesn't correlate with fertility, but patients to sab gade hai. Gynecologists bhi sab gade hai. Unko to kuch samajhta nahi hai. Laboratory mein report aaya. Itna DNA fragmentation normal hai. Itna abnormal hai. Tera abnormal hai. Tu ye goli kha. Ye surgery. Anyway. So that's one set. For women, it's much more. Because obviously, women are far more complicated. So the tests start from even before you actually start your IVF cycle to during the IVF cycle. But it's worst after the IVF cycle fails because that's when they're most vulnerable. Oh, your IVF cycle failed. Now we need to test your chromosomes. Your IVF cycle failed. We need to test your endometrium or your uterine lining for what is called an endometrial receptivity assay. Your IVF cycle failed means your embryo didn't implant. So we need to do an embryo biopsy called a pre-implantation genetic test of your embryo to find out whether your embryo is genetically abnormal or not. Long list. I think it has 33 things. It's on that Eshrey paper. It's called a list of add-on tests and which are useless. There are lots more, but I don't want to get into the technical details.
But can you help us understand what would be the approximate cost of all these tests one by one? Because I want to understand how much money people are spending.
It's unlimited.
But
because the more the tests you do, the more the money. Then you can repeat the test.
But what would be the range? What is the cost of doing these tests?
I think I don't do any of these tests. Okay. I'm not even the right person. But I think an endometrial receptivity assay costs 30,000-40,000 rupees. Okay. Again, like I said, useless. An embryo biopsy costs 30,000-40,000. And these are all add-ons. So your basic IVF cycle, let's say, is 2 lakhs, whatever. Your injections cost 1 lakh. This is just your baseline. And you just keep on adding. And then people will say, in for a penny, in for a pound. Itna sara paisa kharch kare. Doctor bol raha hai, next cycle se chance badhana hai, to ye karo. To theek hai, ye bhi karenge. And then, because you paid for 2 cycles and the first cycle failed, you're stuck. It's a sunk cost. You already paid for the second cycle. Then the doctor will say, first time ke injections थोड़े इतने अच्छे नहीं थे. वो package के थे. हम और अच्छे quality के injection देंगे, लेकिन उसके लिए और 50,000 खर्च करना पड़ेगा. It breaks my heart. So, when I tell patients, मेरा blood pressure बढ़ता है, please don't tell me all this.
So what is the cost of doing one cycle का जो IVF है?
Roughly about 2 to 3 lakhs. Again, it varies. Okay. So it's extremely expensive. And the worst thing is it's an open-ended expense. Because you don't know whether it's going to work or not. So I always tell patients, when you come to me, please remember I'm a doctor. I'm not God. I'm not a fortune teller. And I'm not a mind reader. I'm not God in the sense I can't tell you what the outcome of the cycle is going to be or whether you're going to get pregnant or not. And that's why I'm not a fortune teller. I'll do my best. That's all. I can't tell you whether it'll work. And I'm not a mind reader because these are not decisions you should be allowing me to make for you. You've not broken your leg. This is not an emergency. This is your life. It's your baby. You have options. You can choose not to have a baby. You can choose to adopt a baby. You can choose to do 50 other things. Take your time. What a lot of IVF clinics do is they put a gun to the patient's head. You're already 33. तू तो अभी बुढ़ी हो गई है. तो और 2 महीने रुकेगी तो तेरी और fertility decline हो जाएगी. तो आज से ही IVF cycle शुरू कर. So you don't even allow the patient to leave the room. Then you sign. Anyway, okay. So you create a lot of artificial urgency, pressure, stress. Oh, your level is wrong. If you do 50 tests, एक तो level abnormal आने ही वाला है. The more the tests you do. Anyway, so that's how they convert all these people into this thing. So it's a big problem. So what are we addressing that? Fine. We say I'm an expensive clinic and I'm a private clinic, which is why we funded what we call the Ma IVF unit in KEM hospital. We're saying ideally IVF units belong to government hospitals because that's where the next generation of doctors is. Today, you're turning out MD gynecologists who haven't done a single IVF cycle in their life. All these gynecologists who are practicing have no practical experience. You can imagine, they read all the theory textbooks, so they understand the theory, but they don't know how to handle these patients. So the patient care will improve because the teaching will improve. Patient care will improve because doctors these are young doctors, they're idealistic doctors. They want their patients to get pregnant. Plus, we think research will improve because Indian patients are very different from foreign patients. Foreign patients get married at 38. By the time they go for IVF, they're 39. Our patients are getting married at 25. The tubes are blocked because of tuberculosis. They require a slightly different set of treatments. Many, many things which need to be tweaked for Indian conditions. So I'm very clear, I can't do it. So he said, fine, KEM is my alma mater. Like I said, God is kind, I have enough money. We'll fund the unit. I will not go there. You have enough bright doctors, we'll train them if that's what they want. They'll figure stuff out for themselves. Let them train. So we're trying to create a center of excellence in KEM hospital. We said that's the right place. Because if you create a center of excellence in one teaching hospital, you can replicate it across other teaching hospitals. And then all these poor patients who have no way, just imagine, you can have a baby with IVF, but you can't do anything else because your tubes are blocked. But you can't afford IVF. Just imagine the heartache that must be causing. And I can't do anything to change that because guess what? I'm a doctor in private practice. But if I fund this and the construction's already started, hopefully in the next 2 or 3 months we'll go live, then we think there's a viable alternative. And like I said, there's no shortage of money in India. So that if you can set up one IVF unit which works well, this will be a center of excellence because large volume, lots of doctors, lots of patients, hopefully that will become replicable. We'll see.
And what is the usual success rate in this IVF treatment?
So 2 variables. One is the age of the wife and the second is the quality of the doctor. Those are the 2 most important things. The older the wife becomes, the lesser the chance of getting pregnant. Okay. So again, everyone just quotes the good prognosis patients. So if you give me someone who's less than 35, who's a good ovarian responder, who produces lots of eggs, then the chance of getting pregnant in one cycle is about 40%. Okay. And over 3 cycles, what's called a cumulative conception rate is about 80%, which means you have an 80% chance. Now, if you give me a 42-year-old woman who's producing, then all bets are off. Then everything just takes a big slash. So therefore, we do a lot of counseling, but we also tell patients that's actually a very poor quality because the first question every patient comes is खर्चा कितना होगा, success rate कितना होगा. खर्चा कितना होगा वो तो मैं बता सकता हूँ. Success rate कितना होगा मैं नहीं बता सकता. I can tell you what happens in my clinic. But you know what? You don't care what happens to the other 99 patients in my clinic. You only care what's going to happen to you. Yeah. And I can't tell you that. So I also tell them every IVF cycle is not just a treatment cycle. It's also diagnostic and it's also prognostic. Diagnostic in the sense what went right, what went wrong, did you grow the eggs well, was this the right treatment protocol, what didn't? And prognostic in the sense I can then tell you what your chances in the next cycle are because now I have data which is personalized to you. Then I can extrapolate much more intelligently from that as compared to extrapolating from a bunch of the best analogy I can give you since you're a CA is if you ask me, there's very little point by telling you what the Nifty is doing. I haven't invested in the Nifty, I've invested in Titan. I only want to know how Titan is doing.
Yeah, fair. And I was reading an article in the Ken which said that now like 1/3 of the women after marriage, they are doing that IVF treatment and this number is increasing only. Is that
rubbish? True? This must have been a story planted by some PE IVF clinic. Okay. They're all rubbish. But fertility has not increased. Let me tell you that. Let me explain some things. Infertility has always been a problem through the centuries. Whether you read the Mahabharata, whether you read the Bible, it's always been about 10 to 15%, which means about out of every 10 couples, one is going to have a problem getting pregnant. Even if, for example, you may not know anyone because but if you ask your mom, she will know at least one person. Maybe your aunt was infertile, maybe your but the trouble is you don't know because that side of the family dies out. But so it's always been common, ever. Now, the good news is we have treatment options. That's good. Part of the problem is a lot of what we are seeing is social infertility. What does that mean? It's not like there's been an epidemic of blocked tubes or egg problems or anything else. So a lot of these women are getting married late. Now, this is typically US problems or urban metropolis India problems, not necessarily typical across the board. But when a woman gets married late, a lot of these problems. Now, someone who got married at the age of 38, if she'd got married, if she'd been born 50 years ago, she'd mostly have got married at the age of 25, had a baby at 26, 28, and then not had a baby. Do you understand? So we're seeing an apparent increase, but I don't approve. Now the trouble is, ये Ken वाले story करेंगे, किसको interview लेंगे? Dr. Malpani. Dr. Malpani को क्या leading question पूछेंगे? Dr. Malpani, have you noticed that the prevalence of infertility has increased? Obviously, Dr. Malpani is going to say yes. Loaded question. And Dr. Malpani's experience is irrelevant because, hey, guess what? I'm an IVF specialist. I am going to see more and more infertile couples. That's the nature of the beast. You're asking the wrong question to the wrong person. But anyway. But this is the story they sell to all these investors. So when all these Indira IVF guys will IPO, this is the story they will sell to all retail investors. So many infertile couples, so many potential markets for IVF, so many have never had IVF, and so many will need IVF.
If you learned something new from this video, do share it with your friends and subscribe to this channel so that we can bring you the best content possible. Also, if you want to watch this entire episode, click on the link in the description box and you can go to Kushal Lodha YouTube channel and watch the entire podcast episode. Thank you so much for watching this and have an amazing day.